Hello, my name is Tyson Lee. I am a microbiology student at Sacramento City College. Today, I will be talking about the Zika virus. I chose to do the Zika virus for my Micropia project because I sort of have an emotional attachment with the topic. In terms that, I want to become a nurse. I am an aspiring registered nurse. And one day I would love to work with neonates and pediatrics as my patients. And so later on in the slides, I'm going to talk about the relationship between Zika virus and its effect on neonates and pediatrics. And the infections that these babies they experience is so interesting, and it really intrigues me, and it really makes me sad. And so I really, I feel really, really connected to this topic. And so that's why I have decided to do the Zika virus. Now, the Zika virus is an emerging infectious disease because Zika viruses are RNA viruses, just like the COVID-19 viruses, right? They are RNA viruses, meaning that they have very high mutation rates. And so the last Zika virus outbreak was around 2015, 2016. But, with them being RNA viruses, it's just a matter of time before there's another outbreak. There's also no vaccinations for Zika virus infection. And so we cannot, prepare ourselves for this virus. And so if there's another outbreak, then a lot of people will get really sick, and a lot of babies will be really affected by it, right? And I will talk about how the Zika virus affects these babies in the end of the slides. But Zika viruses, right? Before we talk about them, let's talk about what a virus is and how a virus works, right? I believe understanding the fundamentals will ultimately allow us to understand how Zika viruses really work and what Zika virus really is. So viruses, when they enter our body, and there are many ways a virus can enter our body, right? But when a virus does enter our body, viruses have protein coats on their surface. And those protein coats are going to react with our host cell membranes, right? There's receptors on our host cell membranes, and these proteins and receptors are going to be like a lock and key, and they're going to attach, and we call that process attachment. And when a virus attach to our host cells, they're going to enter our cells. And viruses, they are acellular, meaning that they cannot metabolize on their own. They cannot, replicate on their own. They rely on our host cells. And so viruses like Zika virus, they have to enter our host cells in order to spread infection. And so when the viral RNA or DNA genome enters our cells, they're going to find ways to replicate. And so we see that RNA viruses, they replicate in the cytoplasm with the exception of influenza virus. They, like many DNA viruses, they replicate in the nucleus. And when a virus has replicated in our cells, they're going to reattach, or they're going to build themselves back up, is a better way of saying it. And they're going to then leave the cell, and possibly and potentially and most likely will infect neighboring cells. Right. So just a recap of this slide, virus like Zika virus are acellular microbes. They cannot metabolize and replicate on their own. They heavily rely on our host cells. And Zika virus is a RNA virus. It has high mutation rates, and there are no vaccinations for Zika virus. So Zika virus has an arthropod vector, and the arthropod vectors are the Aedes mosquitoes. And I would like to say that, in order to get the Zika virus, these Aedes mosquito that are biting you, they have to be infected Aedes mosquito. But of course, it's hard to tell which mosquitoes are infected and how to track or prevent mosquitoes from biting you, right? But these mosquitoes, they have to be infected before they can infect you. But these Aedes mosquitoes, they are also vectors for many other nasty infections, right? So Zika virus, dengue fever, chikungunya virus, and yellow fever virus, all very nasty and dangerous respectively. You can also get Zika virus from unprotected sexual intercourse. If you're having unsafe sex with a partner that has, been infected with Zika virus, then you are possibly and potentially at risk for being infected with Zika virus also. Also blood transfusion, right? And so um, it's really a great concern for travelers because if you like to travel around, there are mosquitoes, these Aedes mosquitoes that may infect you. And when you come back home to, the United States or wherever you live, you can, possibly potentially spread the Zika virus to, people around you. And so here's a world map on the CDC. It's published on their website, and it's just color coded every region. And it just, tells you which region has been infected with Zika virus, if they are currently experiencing a Zika virus outbreak, which thankfully there is no countries that are experiencing Zika virus outbreak yet. Um, but you see here, we are purple, meaning that we have had Zika virus in the United States. Um, and so it's just really kind of, useful as travelers to just kind of have this resource to make sure that wherever you're going, you are staying safe and that you are not going to go somewhere where you may potentially, get Zika virus and bring it back home. So what happens if you do get Zika virus, right? Well, if you do get Zika virus, I read that, a lot of healthy adults, they tend to recover from Zika virus. But usually the symptoms is just a little more extreme than a normal fever. Symptoms include, fever, headache, painful or red eyes, itching or rash, muscle pain, and joint pains. But the greatest concern with getting Zika virus is within moms who are pregnant with a fetus, right? Zika virus may not really is not really intensive and virulent when it comes to infecting an adult, a healthy adult at that, but it's very dangerous for moms who are carrying babies or fetuses, and because they can ultimately harm that baby in so many ways, which we're going to talk about. So here are the effects of Zika virus on the fetuses and newborns, right? So if a mom does go travel and she does get bitten by these infected Aedes mosquito and she gets Zika virus, right? Well, that's really bad news because the Zika virus, they can cross the placenta, right? And they can infect the fetus. And when it does that, the baby or the fetus is now then infected with Zika virus also. And so Zika virus can cause miscarriages. It can cause the baby to be born with birth defects. And a common birth defects is called microcephaly. Microcephaly is just another term of saying a small head. But I feel that, the small head is not really, or like the physical appearance is not the greatest concern. But the concern with microcephaly is that, it slows the brain development. And so these babies with microcephaly, they're going to experience a delay in the progress of their developmental stages, right? And so symptoms of microcephaly include like seizure, right? That's so sad. A small head size, which, physical appearance is not the biggest concern, but microcephaly and its progression in developmental stages, that's the greatest concern. It causes delays in speech and movement, and it causes the head to be droopy, right? And so before I continue, I just want to warn that, in the next couple of slides, I will be showing some pretty graphic images of babies with microcephaly. And so if you are sensitive to graphic images, maybe I would advise you to maybe skip this part of the video or skip the end of the video, right? So here's just a comparison of, a baby who has microcephaly and a child who was born healthy. Now, of course, the physical appearance, the head shape is not the greatest concern. Uh, but the greatest concern is that this baby will have a much harder time in, developing and meeting their growth milestones compared to this baby, which is so sad. It's so, heartbreaking, right? And also, babies with microcephaly, they tend to require a lifetime care. And so it's also really difficult on the parents and their families and their loved ones. So here are the graphic images that I've warned you guys about. On the left and the right, it's just babies who have microcephaly, right? You can obviously see that their head shape is a little different. And I've also made a 3D model. It's right in front of me that I'll be showing you guys. But my model is not as great as these images, but I really like to have something in front of me when I'm looking at something. And so I will show you guys that in a little bit. But these images just kind of shows, how devastating it is for these babies to be infected with Zika virus and ultimately be born with microcephaly, right? And here's a New York Times article. It talked about how a child who has microcephaly, who is 2 years old, is comparable to that of a 6-month-old healthy and normal baby, right? Which is, it shows that, these, babies who are growing up with who grew up and they have microcephaly, it's just much harder for them to kind of navigate through life and kind of, be um, on time with their progress and development. And that's just the saddest and the most heartbreaking thing that these babies have to go through and for families and loved ones to see. But that is all for the slide. Um, but here is the 3D model that I made of a baby with microcephaly. My artistic skills may not be the best, but I just kind of wanted to show microcephaly, babies have smaller heads, right? I just wanted to express that in this model. And yeah, so this is my 3D model. Okay. All right, and so that is all for my slides of the Zika virus. If you have any questions, please feel free to reach out and I will try my best to answer your questions. Thank you.